It can be heartbreaking for parent or caregiver to discover that their child or ward is facing difficulties communicating in a manner that many take for granted. Talking is such a routine activity for many people that they often fail to fathom the challenges that children face in acquiring and using a language. Pediatric speech therapy is helpful in cases where children have a hard time mastering verbal communication processes. The professional therapist who is selected to help the child should be one who has been trained and certified in helping children with speech-related challenges. One of the first things that the therapist will do is try to identify the underlying cause for the impediment. This may be something physical or psychological, and it is very important that the specialist be able to factor these two variables into any evaluation of the patient. Most linguists support the theory that language production is essentially the result of a collaboration between the brain and the language-related body parts. They also recognize that it is an intricate process. Disruptions in this process are usually related to cognitive deficiencies. These deficiencies manifest themselves as psychological barriers to speech. Psychological barriers to verbal communication are often associated with traumatic experiences. To identify the specific trauma, the therapist may investigate the child's history to single out incidents such as violent accidents that may mark the beginning of the change. Once the situation is identified, the process of restoration and therapeutic care can begin. Sometimes the language usage challenge has its roots in learning or mental disabilities. Children with special needs, which include conditions like autism and verbal apraxia, are among those who suffer from language deficiencies. Special needs children often need the help of a speech therapist to help them master oral self-expression skills and cope with the frustrations of being misunderstood. Misshapen teeth or other structural problems in the oral cavity are typically the most obvious causes of barriers to speaking. Many times they are the result of developmental lapses that occur during the fetal stage. At other times, they may be caused by physical trauma sustained in accidents or by some other violent means. For physical problems that lead to speaking barriers, one solution may be surgical. Whenever therapists realize this, they refer their patients to professionals who specialize in surgical remedies. After the surgery is completed, therapeutic sessions will still be needed to help the child. It is clear to see, therefore, why there needs to be a close relationship between the therapists and the surgical medical practitioners. Language acquisition and use is by no means the simple, effortless process that many perceive it to be. Parents and caregivers of children who display signs of challenges with language use ought to be aware of one critical fact. Pediatric speech therapy can make a remarkable difference in the life of a child who struggles with oral communication.